present here. It's a second lecture series on medical education, basically. First happened in the absence of Honorable President. So today we requested him to be with us in this lecture. And today's lecture is basically on preventing diabetes and its complications, taking charge to make a difference. The speaker is none other than Dr. S. Madhu. I know him for several years because of Dr. Ashwini. He is a top-class professional as well as a teacher, doctor, and an administrator. He is Director, Professor, Department of Endocrinology and Metabolism, University College of Medical Sciences, and Guru Bahadur Hospital, Delhi. So we welcome you, sir. Please take stage. We also welcome Dr. Ashwini, with whose initiative and our president's thinking that something new should be done in this university. He always keep on thinking about the stakeholders, about the various community, help and all those things. So he thought that this should also be started. So we welcome Dr. Ashwini as well as Honorable President Professor K.K. Kumar. As you know, that first lecture was solving common eye problems to improve quality of life by Professor Jeevan Chettiar. And this second lecture in the series is by Dr. S. Madhu. Now, last time we heard the message of our Honorable President. All of you know that he is a visionary. He is taking this university forward. He is a top-class engineer, scientist, academic researcher, and a able administrator. So all qualities together, difficult to find in any academic. So let us first of all hear from him about this series, and then the stage will be given to Dr. Ashwini, who will manage the show further. Thank you very much, and once again, welcome to this program, sir.
Thank you, Dr. Speaker, for giving me introduction. On behalf of the university, and for organizing this beautiful lecture for the welfare of all non-industry. As Professor once said, Dr. Ashwini is a clear-cut example of interest which we talk about the university. To give up the medical profession, to pursue other things is not very common, and that's what it is. It may be emotion and everything. And I suppose this is this morning Professor C.P. Raman, the great physicist with the black covered on the reports, and he used to play with it. And one of his research papers is that if you want to cater with them, the best food is jackfruit paste. Now, this that is jackfruit free book will be the best for someone who is professional. And only now, if you go for the business, and then you know what it is. So that is where it is directly really count for some researches which cannot be done unless you are safety. So I'm sure Dr. Ashwini will never agree that he is giving like to others that how can they will probably bar the world of more. Professor Madhu is embodiment of one of the best professions in the country. And more than the medical profession, we always aware of the society. I'm grateful to you personally, sent our speech to be here today, and give some fundamental results. Most of us in the front rows have some confrontation with the subject of which we are talking about. But to leave us knowledge, I will have to make us wiser. And I will just see what I have already that Dr. Madhu talks about Madhu so with these words, I welcome Dr. Incidentally, Dr. Minister accepted our request to organize this next person. Being the first I first so taking this action for us, for us.
Namaskar, dear Sajjano. Good evening, ladies and gentlemen. I, Dr. Shri Kumar, on behalf of South Asian University, the university established by Star Nations, welcome all of you, particularly the beloved students and the best wishes for the successful orientation of your planned endeavors in your life. My suggestion is try to reach the top. That place is always good. It's a medical series for public awareness. In regard to medical conditions or early signs, prevention, management of diseases, conditions in common medical perspectives by eminent medical consultants. World Diabetes Day is observed every year on November 14. It's the birthday of Dr. Frederick Bandy, co-discoverer of insulin, the medication being used to treat diabetes, along with Charles West, J.J.R. and James Collins in 1941. Anthony and Madhu were awarded a prize in 1933, which they shared with the rest of them. Month of November is full of celebrations in the form of talks, seminars, workshops. That is why we all are here on November 18. Topic for today is preventing diabetes and its complications, taking charge to make a difference. Consultant speaker is Dr. Siri Venkat. I would say in this regard that let the sweetness remains confined to our tongues, as in our speech, or in all dealings with a fellow human being, and don't let it travel beyond the normal limit in our life. मगर काश ऐसा हो सके हमारी सच्ची सोच के बावजूद diabetes with its rising prevalence in our country is an important health concern and people do suffer. Now it's our duty to find out the ways out and encourage people to live with diabetes in a normal course through powerful messages in the form of slogans. Diabetes is not the end, it's the beginning of a new way of living. Motivation is what gets you started. Habit is what keeps you going. If for some time you cannot do great things, do small things in a great way. I don't live with diabetes. Diabetes lives with me. And I'm stronger than diabetes. आप जब हर हाल में हर तरह की बीवी के साथ रह सकते हैं, तो डायबिटीज के साथ रहने में क्या मुश्किल है? ऐसी सोच नहीं रखनी कि किसी को पूछा कि आपकी बीवी कैसी है, उसने जवाब दिया जल्दी से बोल है, बड़े खुशकिस्मत से भैया मेरी तबीयत ठीक है। और किसी ने अपनी बीवी से कहा कि मुझे एक पढ़ी लिखी औरत से शादी करनी चाहिए, बीवी ने कहा कि तुम्हें पढ़ी लिखी सहायता नहीं देता हो, कहता बस मैं यही प्रूव करना। डॉक्टर की सलाह देते हैं कि टेंशन लेकर नहीं सोना चाहिए। आश्चर्य की बात है बीवी को वीडियो दिखा संजीदा व्यक्तित्व के मालिक, अच्छी सोच के धनी, sharp focus and brilliant communication skills, आत्मनिर्भरता और खुददारी की जीत की जाती मिसाल डॉक्टर श्री वेंकट मधु, kindly give a big thanks. डॉक्टर सुमन बता चुके हैं कि डायरेक्टर प्रोफेसर हैं डिपार्टमेंट ऑफ एंडोक्रिनोलॉजी एंड मेटाबॉलिज्म, यूनिवर्सिटी ऑफ मेडिकल साइंसेज, यूनिवर्सिटी ऑफ मेडिकल. Academics and research achievements are more than 250 publications in peer-reviewed journals, written 25 chapters in various books on endocrinology, more than 20 funded research projects from ICMR, DBT, and Research Society for the Study of Diabetes in India. Awards and honors: Research Society for the Study of Diabetes in India, Service Award, Daily Stage Award, MMS Ahuja Oration, PG Mehta Oration, Fellowship of National Academy of Medical Sciences. Representation in national and international societies, Editor-in-Chief, Indian Journal of Endocrinology and Metabolism, International Journal of Diabetes in Developing Countries, Diabetes and Pregnancy Study Group in India, serving as expert member of Scientific Advisory Group and Project Review Group of ICMR, NIN, DBT, and so on. जिन्होंने अपने एक मरीज से ये पूछा कि तुम्हें क्या लगता है तुम्हें डायबिटीज क्यों हुई? मायूस होकर मरीज बोला, डॉक्टर साहब बड़ा मीठा नशा था उसकी तभी तुम डायबिटीज के शिकार हो. इनके चेहरे की सादगी में ऐसा जादुई लगता नजर देखकर था, और कुछ ऐसी भी है जो देखता देखना है. मैंने तो ये भी सुना है खुदा जाने मेरा क्या वजन है उनकी निगाह, सुना है वो औरतों को नजर से धोते. आपने एक बात मुट्ठी की इनके नाम के भी लिखा है, श्री डॉक्टर श्री वेंकट मधु, हनी स्वीट पर्सन. मेडिसिन के अलावा खेलों का शौक है, खासकर एक बार उन्होंने बयान किया, इफ यू रिमेंबर देयर वाज ए फिल्म एक्टर अजीत, उनके बहुत चुटकुले बहुत बातें तेलुगु. सुनील गावस्कर was touring West Indies as a captain and match पे मैच हार रहे थे. उन्होंने कहा कि अजीत भाई कोई हमें मैच तो जितवाए, अरे सैनिक जितवाएगा तो मैं एक काम करूं, पहला ओवर कार्सन खाली सीखे वो शॉट फुटबॉल देखिएगा, रिक्स फुटबॉल के शॉट कार्सन खाली दूसरी बार भी शॉट देखिएगा, रिक्स फुटबॉल के छक्का लगाएगा और बॉल को लीड के पार. क्या बात कर रहे हैं भैया, छक्के तो छक्के लगा सैनिक. अब हमारी वीर पवेलियन के बाद कुछ हमारे कार्ड तो तुम्हारी क्रिकेट की बॉल से अपनी क्रिकेट की बात बदल गई. हमारी क्रिकेट की बॉल में टाइम बॉम्ब फिट बॉल क्रिकेट ग्राउंड पर आए. कार्सन काफी तीसरी बार की शॉट खेलेगा, उस पर छक्का लगाने की कोशिश करेगा और रिचर्ड इस दौरान खत्म बॉल आ गया. तो सभी ने पूछा कि उसने इसी बॉल पे छक्का ना लगाया तो सैयद पेवानी की कुर्बानी. हर तरह के संगीत का शौक है. मैं कह चुका तेलुगु भाषी होने के नाते हिंदी फिल्म का श्री 420 का गाना है, उसका ओपनिंग वर्ड उन्होंने मुझे समझाया, रमैया बरसा रामा तुम कब आओगे. This is the meaning of the word Ramaya Varsavaya. Ramaya Varsavaya, Ramaya Varsavaya. और finally इनके हसीन रूप में आज नया साउथ एशियन यूनिवर्सिटी की अवार्ड का खेल बन जाते हैं. तो बताइए उनका क्या है. डॉक्टर मधु गाँव
The topic is the problem in diabetes. The other thing is that, as you all know, diabetes is a major problem in the country. How many of you don't know that diabetes is a problem? And that problem of epidemic proportions in India, everybody is concerned about diabetes. The president of just mentioned that some of you in the front benches must be having diabetes. In fact, most of the families in a place like Delhi would definitely have one diabetes, even though there is more families maintaining them then. So it's so rapid, and therefore I think we need to talk a little bit and have a conversation on diabetes during the course of next 30 to 40 minutes. The purpose of talks like these, and as you know in the topic, the second line says taking charge to make a difference. That means don't leave the job to others, to a leading physician, or to some public health expert. We need to take charge ourselves, not only in treating or managing our diabetes to a large extent, we have to contribute, be active participants, and if we don't have diabetes, we should actively strive to see that it does not happen to us. And therefore, the entire focus of treatment and definitely prevention lies on us. How do we do that? We need to get empowered. And it's sessions like these that aim to empower everybody at large so that they can take care of themselves in terms of prevention of diabetes and if they are diabetes already manage the diabetes effectively. Therefore, the importance of diabetes awareness. We should all be aware of diabetes. And what do we mean by diabetes? We need to understand that it's those things. Some of you may not be able to read the small print, it doesn't matter. I will be speaking out the same to you or you understand the gist of what we understood. First, we need to understand that it's a problem. That's something I'll talk about initially and also learn from you how much you are aware. Then we'll try to understand the disease itself. We need to understand a little bit of what is diabetes. Only then we will know how to prevent it, isn't it? The third, of course, is the empowerment of individuals in terms of how exactly to go about managing or preventing diabetes. With these three things in mind, let us start. First part is to understand the problem of diabetes. Any person what I do is I just show you two slides to show you how important it is globally, and we ask each other to find out do we know how much of a problem it is in our country. Okay. This is what comes from the International Diabetes Federation, which is saying for the entire world, it's spiraling out of control. 1 in 10 adult diabetes the world over has diabetes. And it's means about the age of 20. Huge problem everywhere in the world. The figure is mind-boggling. I don't have to go through each of these figures. The important thing to understand is that it's in billions, close to 500 million. Important thing again, and that's why we need to know about what is diabetes. If one who do not know that they have diabetes, unless there is screening, they don't have symptoms. 4 in 5 live in low and middle income countries. 4 out of 5, 80% of the diabetes is in low income countries, and South Asian countries, SAARC countries are all, they all belong to this category. So it's relevant for all of us, including Indians. We have the bulk of diabetes in the world. Not only that, we will be having the bulk of diabetes over the next decade or 2 decades. So the problem is entirely ours. That is understood, then syntax is everywhere. Okay, I go to the students first and find out. Anybody wants to say or does have any idea about how common diabetes is in this country or what is the prevalence? कितना common है? कितने million होंगे या percentage को बताना चाहो? Let them say it's not that common. Anybody wants to hazard a guess? I can't cross this if yes doesn't matter. Yeah, anybody? कुछ तो बहुत गलत है क्या मतलब? Anybody? Any idea? कितने मिलियन होंगे वर्ल्ड में तो पता नहीं हमें कितने मिलियन होंगे डायबिटिक इंडिया today the figures are we come to the figures in terms of percentages more than 10% on an average in the country rural urban all put together about 11% is the national figure we come to that of all adult individuals about 20, which means 1/10 of India above age of 20 has diabetes. And this is rural, urban, everything put together, not urban. Okay, so it's a huge problem. So those who are not yet aware, maybe some students knew but were shy to speak out, you be aware that this is a huge problem all of us need to know and worry about. Okay, so now let's next few slides we'll see the actual figure. We may not see this, but if you look at the second bar, blue bar that is India. The top 10 countries of the world, India is number 2, China is number 1. As of today, as we speak, India is overtaking China. We were first in this capital of the world, became number 2, now we are almost to number 1. So we are, as Indians, we are very good at this the most. And let's look at the first column. You will see diabetes is 11.4%. That's the national figure which I was talking about. What is more important, if you are able to see the second row, below diabetes is something written as pre-diabetes. Does anybody know what is pre-diabetes? Any of the students or anybody? Pre-diabetes क्या होता है? Pre something. Diabetes, pre-diabetes. Pre मतलब पहले. So what can pre-diabetes be? Certain sugar levels which is not normal, but is not yet frank diabetes. So stage before actual diabetes has occurred. That's pre-diabetes. That means these are high-risk individuals who can become diabetic any day. They're not normal individuals. If you look at that, figure is 15%. So we add the two, almost 26-27% of adults either have pre-diabetes or diabetes. And this is rural included. Urban figures are line bounding. Urban and metros, we talk about Delhi. There's a lot of obesity, as you can see. The first row says generalized obesity, which is obesity as we all know. The second row below that says abdominal obesity. And that's the problem with all South Asians, including Indians. I'm stressing the word because this is your South Asian university. So all South Asians share this common problem of abdominal obesity. Most of the fat that accumulates in us is mostly or primarily around the waist, around the abdomen. So you don't know our waist like that ball, a big paunch. Compared to the Westerners who are heavily built, but all around, not just the waist. So if you see, as you can see here, 40% individuals have abdominal obesity. And less obesity is much less, only 28%. Therefore, this is what is driving in a way the diabetes epidemic has become. This is the study we did in Delhi, just to give you an idea about what happens in metros. अभी तो सिर्फ नेशन की बात कर रहे हैं. अगर दिल्ली की बात करें, most of the metros are similar. You do not read the figures that are there. Diabetes itself is about almost 20%. 19% of Delhi above age of 20 has diabetes. Another 25%, no, another 30% has pre-diabetes. So the two together, nearly half of Delhi above age of 20 is either diabetic or at the high risk for diabetes. Unlike the national figure, उसमें तो सिर्फ 25% यहाँ 50%. So we should really worry about diabetes and please be aware of the condition which is so rampant all around. Okay. Why this happens? Why is there so much obesity? Why is diabetes happening? This is a national study which actually shows that in general Indians are sedentary. They don't indulge in any physical activity. Most of us prefer to be, at leisure, not doing any sports or physical activity, particularly in the urban areas and particularly rural. This is what the study shows. So that is one common factor which we need to correct. Okay, so that was the problem. अब तो problem समझ में नहीं है सब लोगों को या नहीं? Okay, so we are dealing with something which we need to prevent. So now let us understand the disease itself in the next 5 minutes. Diabetes होता क्या? What is diabetes? Anybody? ये तो बता दीजिए इसको somebody can the other anybody can. What is diabetes? What do you understand by diabetes?
हाँ जी आप बताओ कुछ तो माइंड में होगा डायबिटीज सुना होगा
Basically, the condition sugar levels are not regulated by our body. So high amount of sugar is present.
ओके
So high sugar levels in the body is diabetes. Any reason
you want to differ with him or it's the same
It's the same, and it's not regulated.
it is not regulated in the body. So okay. Basically, diabetes is a condition where your blood sugar, we call it blood glucose, not just sugar. Sugar can be anything even other than glucose. So blood glucose levels are higher than what they should be. That is what is called diabetes. Okay, we'll come to the numbers later, but this is in short what is diabetes. So we try to understand these few things. वही है जो आपने कहा, but little more comprehensive. Body cannot use it properly. That's what you said. Regulation. You can't regulate the sugar. So the sugars cannot be, or the glucose cannot be effectively used for energy. Therefore, they start rising in the blood. That is it. Why it is important? Sugar बढ़ गया तो बढ़ने दो तो उससे क्या? ये महंगे बात नहीं बढ़ने की वीडियो में उससे बढ़ गया थोड़ा ज़्यादा हो गया उसको
बढ़ने से कोई प्रॉब्लम
no problem. Anybody? So what is the blood glucose levels are high? Okay. So that is the issue. Blood glucose level बढ़ने से अपने आप में कोई प्रॉब्लम नहीं है. लेकिन if you allow that to remain high, it can affect almost every organ in the body. Every organ. We only talk about 3 or 4 important organs, but you should not be aware that it can affect and cause damage to every organ in the body that you can think of. Therefore, it is important, and therefore you cannot allow blood glucose levels to be high. You may question the other, but there are 2 main types of diabetes, which again we should know. There is a third disease here, there are many more, but the most common diabetes all of us should know. Type 1 and type 2 diabetes. Most common thing, and most of my talk will be centered around that, is type 2 diabetes, which is the more common, which is the cause of the huge numbers that I just mentioned. As you can see, 90 to 95% of all diabetes is type 2. Only 5 to 10% is type 1. There is gestation things in pregnancy, and other types are also there, which is very rare, comparatively rare. So type 2 के बारे में ज़्यादा बात करेंगे. What is the difference between the two? We'll come to shortly. We first ask you, anybody knows type 1 or type 2? We can forget if you know the types. What can be the difference from type 1? My girls even in school, this is taught. Yeah, good. Type 1 diabetes, the body's immune system stops making the insulin cells. While in type 2, the insulin does not respond properly. Very good. What he's saying basically is that in type 1 diabetes, the body loses the capacity to produce insulin because generally immune system alteration that is correct. But the net result of the immune system injury is pancreas cells which produce insulin die and you cannot produce insulin. So there is no insulin. That is type 1. So you treat it only with insulin. Type 2 disease, on the other hand, pancreatic cells do make insulin, but the insulin doesn't work efficiently. We call that insulin resistance. So the insulin is there in the body, may not be in normal amounts, but it cannot work efficiently. That's the basic difference. Okay, so it can be treated even without insulin. Why do blood sugar levels rise in diabetes, for example? When you see at least the thin pictures from there, the top picture is indicating that blood glucose level depends on 3 things. Whether you are normal or whether you are diabetic, doesn't matter. These are the 3 factors which have to determine what will be your blood glucose level. One is the diet that you take, particularly the carbohydrates. Carbohydrates say glucose. Some of you have read biology in school. Physical activity. Physical activity, what does physical activity do? What is need for physical activity? Energy. Energy कहाँ से आता है? Ultimately, glucose. Glucose gets converted to energy, whatever. Glucose is required for that. Fundamental fuel for energy is glucose. So जितना आप exercise करोगे, उतना glucose consume होगा for that energy. Diet जितना खाओगे, उतना glucose बढ़ेगा blood में. And third thing is insulin, which we just discussed. Pancreas is one of the regulator. That's a hormone which regulates. So depending on how much you eat, how much you exercise, and how much insulin is there in the body, your blood will vary. Normal person is all well balanced. जैसे खाना खाता है इंसुलिन निकलता है और it controls the glucose, takes it into the tissues, gets converted to energy, and blood glucose remains within the limits. In a diabetic individual, because of the reasons mentioned by him, the glucose cannot be converted to energy because there is no insulin or it is not working. No energy will convert to blood में ले जाता है, blood के level पर ले जाता है. Simple, isn't it? So that's how blood glucose level, right? So this is normal. If you imagine insulin as a key, that is what is making the glucose enter the muscle or the tissues. Type 1 में होता ही नहीं, की नहीं है, चाबी नहीं है, और फिर म्यूजिक भी सुनता है. टाइप 2 में इनफ इंसुलिन नहीं है, या इंसुलिन काम नहीं कर रहा. So we have elevated blood glucose levels. What can be the risk factors? क्यों हो जाता है diabetes? ये तो ये समझेंगे तो प्रिवेंट कर पाएंगे. Whatever the risk factors, anybody wants to mention what leads to diabetes? क्या risk factor होते हैं? Genetics, obesity, lifestyle, sedentary lifestyle, anybody else? Anything else? Any other risk factor?
No exercise.
Sedentary बोल रहे हो, exercise good. Anything else? Students को भी बोलना चाहिए something. You know. I'm sure you know. It's not as if you don't know. You want to say something? Anybody? Or कुछ?
Excessive carbohydrate intake.
Excessive carbohydrate intake. Okay. Okay. So stress. Nobody mentions stress. I was expecting it from students. आपको stress काफी होता होगा ना? तो फिर आप बताते क्यों नहीं? और यही प्रिवेंशन के लिए डॉक्टर को मतलब से आपको प्रिवेंट करना है, स्ट्रेस कम करना है. पहले ये समझो कि रिस्क फैक्टर है. So we need to understand the risk factor in order to understand what we have to reduce, isn't it? In order to prevent diabetes. But if you have a diabetic patient in the families, the chances of you becoming diabetic are high. If both your parents are diabetic, but the chances are even greater. So to that extent, yes, genetics and family history does play a part. If your family में diabetes है तो आपका risk बढ़ेगा. तो risk factor तो है, correct. तो ऐसा नहीं है कि family में diabetes है किसी को तो आपको होना ही होना है. It is not mandatory or essential. It will also depend on your lifestyle. Stress हो गया. Some people also are talking of a few more novel risk factors. I'm not going to depth of it, but two things you see around. One, we are all surrounded by it these days. Pollution. Environmental pollution is a major risk factor which is coming up these days, especially in urban areas, which has been shown to be associated with diabetes. PM 2.5 जो कहते हैं ना उसको लिंक किया हुआ है. That's another risk factor which is important to understand. Therefore, beware of polluted environment. Do whatever you can to. That cannot change. At least protect yourself. That's one. And the second is, some of you might get into some jobs which have shift in of night shifts. That also has been linked to. It's an occupational hazard which can result in that. So these are the things we need to keep in mind. So if you have one risk factor you cannot avoid, at least focus on the others and make sure that they don't complicate each other.
सिम्टम्स तो सबको पता ही होगा, डायबिटीज के स्टूडेंट्स को पता है। सिम्टम्स तो पता ही होना चाहिए ना, because unless you know the symptoms, you cannot recognize this you got diabetes state. These are some symptoms which are listed here. For those who cannot see, the most common symptoms which most of us probably also know: excessive hunger, excessive thirst, and excessive urination. These are the three classic symptoms of diabetes. Whenever and is directly related to the level of blood glucose. The higher the sugar, it passes in the urine, so more urine, the more you lose water as urine, the more thirsty you become, so you take more water. And because the glucose is not getting into your muscles as energy, your body feels as if you have not eaten. Your brain senses as if you have not eaten because it's not reaching where it should reach. So you start eating or you feel hungry and you eat. So these are the classical symptoms along that you have weight loss, tiredness, and lot of other. But most patients do not have these symptoms, particularly diabetes. We don't have these symptoms. Type 1 patients have these symptoms classically. Type 2 patients only, let's say 10 to 15% will have these symptoms. So it's a mushkil. So type 2 diabetes is generally recognized when it has one or the other complications or some other coexisting illness. For example, infections. बार-बार infection हो रहा है, आँख में infection हो रहा है, urine infection हो रहा है, skin में infection हो रहा है. Maybe you have diabetes. That's one warning sign. Or you have a heart attack for no reason. Then you do blood glucose is high. Or you have a stroke. Stroke means paralysis. Again, you don't know. And you do blood glucose is high. So it is generally detected in the context of one or the other coexisting conditions or a complication. तो ब्लड ग्लूकोज कब चेक करना चाहिए? एक तो ये है जो सिम्टम्स बॉडी साइन मैंने बताया, वो अगर है तो करना ही चाहिए. But the other side of the story, which again we should be aware, which is relevant to prevention, 50% of patients with diabetes or who have high blood glucose have no symptoms or no warning signs. अगर उसके वेट करेंगे तो 50% of the time you will never be able to diagnose diabetes in time. Asymptomatic. It is also called, diabetes is also called a silent killer. सुना होगा ना silent killer? इसलिए कहते हैं silent killer. पता ही लगता है. Blood glucose बढ़ा हुआ है, symptoms नहीं है, कुछ नहीं है. Finally, one fine day you land up with all the complications, and then you must have had diabetes for years, which you never recognize. And I also showed you in one of the slides that half the people did not know they had diabetes. So you need to screen for diabetes. You पता नहीं लगता. The risk factors going into all the बताया इसमें सब आ गए. Healthy diet, overweight, family history. Indians generally have. Indians are supposed to be, all some nations for that matter, are supposed to be genetically predisposed as a nation to diabetes. हमारे तो already excess risks हैं. कंफर्म कैसे करते हो? हमने ब्लड ग्लूकोज चेक तो कराया, लेकिन पता कैसे? ये नंबर हमें सबको पता होना चाहिए. Every person, whether doctor, non-doctor, these days should know the numbers. ये 2-3 नंबर तो हमें याद रखने पड़ेंगे. First of all, diabetes can be confirmed only by a blood test taken from the venous blood through a syringe. मैं सारी बातें दोबारा रिपीट कर देता हूँ, because malpractices काफी होती हैं और गलत फहमी होते हैं. Not by capillary method, not by glucometer. Diagnosis की बात कर रहे हैं. We talk about diagnosis. You do not diagnose diabetes by a glucometer. I'll tell you later. But please remember, if somebody has to confirm diabetes in you, it has to be through a regular blood test done in the lab. Okay, number one. Number two, diabetes is not confirmed by a urine test. आजकल वैसे काफी होते हैं, पहले बहुत कॉमन था. Urine test से diabetes confirm नहीं होता. There are several fallacies. This so you don't know. Capillary is not used because the cutoffs are based on venous blood glucose, not on capillary glucose. Plus, capillary glucose has several limiting factors. It is okay for monitoring, and knowing the pain in an already diagnosed case, but not to make a diagnosis. क्यों? Diagnosis lifelong. मैं आपको आज कह दूं कि आप diabetic हैं तो half the people get into severe depression. So you must be absolutely sure before you call somebody as diabetic patient. तो कैटेगरी पे करें और उसकी limitations कहीं हैं, उसको ध्यान में नहीं रख रहे हैं. So and that patient is going to get into depression even though he may not be diabetic. So don't ever believe that you are diabetic unless somebody has tested your blood glucose in the lab, that too at least twice. And the numbers are fasting should be 126 or more. And PP, that is post glucose, again it has to be after glucose. कंट्रोल के लिए तो ठीक है, वही खा रहे हैं, उसमें आपको कंट्रोल करने के लिए पता लगाना है, उसके लिए ठीक है। वो हेल्थ चेकअप में जो करते हैं वो they only indicate that you might be diabetic, you are likely to be diabetic, please get yourself checked properly in the lab. They cannot say or label you a diabetic. Health check obviously you cannot do glucose in everybody. Your screening you can even do with a glucometer, fine, but glucometer will only give you an indication. They say you are likely to be diabetic, please get yourself checked in the lab. हेल्थ चेकअप कितना तो हो सकता है ना, ब्रेकफास्ट का भी खिला के कर सकते हैं, लेकिन कंफर्म नहीं होगा, आपको कंफर्म कराने दोबारा जाना पड़ेगा. That's what is important to understand. अब असली बात पे आ जाते हैं. शुरू में हमने बात करी that we need to bother about diabetes because of its complications, not because of just the number. This is the reason. Association with debilitating complications. Some of the complications can be really devastating, and debilitating means you can be sometimes in bed, lose a limb, have a heart attack, totally be disabled, cannot function, be non-productive. कुछ भी हो सकता है अगर आप टाइमली मैनेजमेंट नहीं करें. इसलिए डायबिटीज को डिटेक्ट करना और टाइमली ट्रीटमेंट करना बहुत. And also it's like loss. That's by the way, even managing complications is much more expensive. Managing diabetes is far easier and far cheaper. The important thing is both complications of diabetes, if you have diabetes, as well as diabetes itself, both can be easily prevented if you act in time. So therefore, we are going to talk about how to prevent diabetes. Complications will prevent possibility. Even if you have diabetes, which is our main worry, but we have to act in time. Can't allow the complications to reach a particular stage. उसके बाद ही कुछ हो सकता है. So early diagnosing the complications or early control of the risk factors for complications. वो किसी साथ काम नहीं किया. वो करेंगे तो आपके complications at least delay हो जाएंगे. Okay, stress number one. Diabetes itself, जो diabetes इसको है ही नहीं, they can prevent the onset of diabetes by several years or even decades or even lifelong if you change your lifestyle, which we'll talk about. Therefore, what are the complications? Anybody? Complications को कोई बताया नहीं. एक लड़का बता रहा है बार-बार. आप पढ़ के आओ. Okay. High blood pressure. और कुछ? Any other complication? ये तो हम लोग बताए थे कि ये ग्राउंड लगे हुए हैं. फटीग is a symptom. High blood pressure बता दिया आपको. आप देखिए बता सकते हैं. Low vision, eye complications. और कोई eye के अलावा और कोई और है? मैंने शुरू में बताया any organ, but important kidney, good, liver, anybody else? Anything? Teeth. As I said before, no organ is spared. So every organ is affected, but the important ones, which can lead to life-threatening complications, can result in early death or major disability. We talk about only those. बाकी सब correct है. हम तो बोल रहे हैं all those organs and even others can use.
Nerve issues also.
Nerves, correct. So basically we focus on only 4 or 5 important organs. Heart, मैंने बताया था heart attack ज़्यादा हो जाता है diabetes. We talk about heart, kidney, eye, and nerves. Nerves की वजह से क्या होगा वो भी बात है. what somebody mentioned, high blood pressure, it's not actually a complication of diabetes, it's a sister brother or a cousin of diabetes. जब आपको डायबिटीज होगा या तो साथ में ब्लड प्रेशर भी होगा, आज नहीं है तो आपको फ्यू इयर्स हो जाएगा। अगर आपको आज हाइपरटेंशन है, अगेन अभी डायबिटीज नहीं है तो कुछ समय में हो जाएगा। They both share a common path, so they are not complications of each other, but they are comorbidities because एक रहेगा तो दूसरा आ जाएगा और दोनों होंगे तो सब बाकी सब चीजें और जल्दी हो जाएगी। So it's important. We talk about that also very briefly. शॉर्ट टर्म में बहुत कुछ होता है कि मेनली टाइप 1 में होता है, ब्लड शुगर लेवल इतने ज्यादा बढ़ जाते हैं कि पेशेंट की बिल्कुल अनकॉन्शियस नहीं डाई इट्स कॉल्ड डायबिटीज। जब शुगर लो हो जाता है दैट्स ओनली ऑन ट्रीटमेंट, इट कैन गो सो लो दैट यू कैन गो सो मेनी सिम्पटम्स, अनकॉन्शियसनेस, समटाइम्स इवन डेथ। इसको शॉर्ट टर्म में लॉन्ग टर्म कॉम्प्लिकेशन, स्ट्रोक इज अ पैरालिसिस, एक साइड की लंबा जिसको बोलते हैं, it is 6 times more common to diabetes, so it's very important. Stroke होता है लेकिन नॉन डायबिटिक में भी होता है, लेकिन in a diabetic patient the risk is on an average 4 times more. Retinopathy, somebody said eye disease. Eye में बहुत कुछ होता है, but the most important thing that we focus upon, which if you don't pick up in time can lead to blindness, that cannot help, is the retina, effect on the retina. That is पर्दा होता है उसका अंदर, where the image forms. Diabetes affects that of the eye, and it is 25 times more common than a non-diabetic. बहुत ज़्यादा. As we will see probably in the next slide, diabetes is the commonest cause of preventable blindness. Kidney, इसमें होता बताया, kidney end stage failure, again 17 times more common, diabetes. Heart disease, 4 times more common. Nerves, किसी ने बोला nerves के वजह से affected, you can have secondary effects, you can have infections in the foot. मरीज को पता ही नहीं लगेगा कि उसको चोट लगी है, that can involve any infection like gangrene, what we call very good amputation. So again, diabetes is one of the commonest causes of amputation of the lower limb or the legs, the feet after accidents, after roadside accident. Roadside accident what happens? तो एक डायबिटीज की बीमारी है जिसकी वजह से amputation होती है, पैर को काटना पड़ता है। Same thing. Just mentioning same thing. Most common cause of non-traumatic amputation, commonest cause of arrhythmia, commonest cause of adult blindness. Diabetes is that.
What about liver?
Liver is not a complication of diabetes, it is an association of diabetes. That means जो जैसे फैट लीवर में भी गड़बड़ होता है, लिवर में भी गड़बड़ होता है, मसल में भी गड़बड़ होता है, तो लिवर is one of the organs which if you don't which we call a fatty liver, आप ज़्यादा खाते हो फैट में होता है कि फैट टिश्यू कहते हैं उसको, फैट जमा होता है और ऑर्गन्स में, जब पेट में और फैट टिश्यू में जब भर गया, मोर एनर्जी और ईटिंग टू ईट, और फैट और यहाँ पे से बढ़ेगा एक लिमिट के बाद, then it goes to other organs. One of them is liver, one of them is pancreas, one of them is the heart, one of them is the kidney. उसी की वजह से ये सब हो रहा है। तो लिवर में भी फैट जमता है, it's correct. So whether you are diabetic or you are not diabetic, obese, eat more, तब भी लिवर में फैट जमेगा और उसके वजह से ultimately diabetes होगा। और diabetics में ज़्यादा लिवर में फैट जमता है, that also is correct. So it's a two-way relationship. It's not treated as a complication in that sense, but a very common association. Heart attack ज़्यादा होते हैं, chest pain ज़्यादा होगा। Again, I said silent killer, तो heart attack में भी silent heart attacks are more common in diabetic. कई बार नर्व होता ही नहीं, because nerves का effect होता है सब जैसे, nerves का effect होता है, तो nerves के effect से कई बार pain का पता नहीं होता, तो heart attack होगा और effects होंगे, दर्द नहीं होगा, कई बार ऐसा भी हो सकता है, other symptoms से पहचानना पड़ता है। So one has to be even more alert in recognizing heart attacks in a diabetic patient. Cataract is much more common in a diabetic population. वो तो है ही, कैटरेक्ट भी ज़्यादा देखा जाता है और अर्ली देखा जाता है। Normally cataract is 60-70 people, diabetes is 40-50 people. And the common cause of decreased vision, of course, retina kidney atrophy. Nerve system is already said. It can lead to blindness, kidney, and ultimately not able to feel anything. Associated depression of obesity or marker or somebody high blood pressure. High cholesterol is common cause of diabetes. These are all home existing disease conditions. So the question is, can we do prevention? तो सारे गवर्नमेंट को सुन के डर लगता है कि ये सब हो जाएगा तो we can't live. But what we can do about it? Can we prevent these complications if we have diabetes? If you are a diabetic patient, or what forbid, some of you become diabetic. आपको ये 5-6 चीजों पर ध्यान रखना पड़ेगा. First, strict control over blood glucose, whatever it takes. We are not discussing कि क्या क्या इलाज होता है, but जो भी डॉक्टर बताएगा strictly follow करिए, blood glucose को range and target में रखिए. First rule. Second, but it is not enough. It is not enough. Although the disease says that blood sugar is emergency diabetes, but it is not enough. If you control your blood glucose, you also need to control blood pressure, cholesterol, and also see that your eyes, kidneys, feet, and gums appropriate preventive measures. And it has been seen, as you can see from the slide, many of the complications will be prevented. If some of you ask if you is a diabetic patient, he would very well recognize that the doctor would have told him आप जरूर टेस्ट करवाइए और not only टेस्ट करवाइए आप once in a year primary checkup कीजिए. चाहे आपको कोई सिम्टम हो, चाहे आपको धुंधला दिखे या ना दिखे, either you are able to see properly or you have any ocular symptom or eye symptom, you must get an annual retina check done as a routine to detect eye complications at the beginning and early stage. Early stage में अगर complication detect कर लेंगे तो आप डॉक्टर आपको मदद कर पाएंगे. आप अपने आप को complication या blindness से बचा पाएंगे. अगर late हो गया and you get findings on the retina which have crossed a certain stage, even doctors can help you in a limited way. Therefore, get yourself screened. अगर आप screen करते हैं timely, तो ये देखा गया कि 90% of blindness prevent होती है. That is the power of screening. अगर आप foot care program, simple foot care measures आपको, I'm not getting into the details, but if your educator or doctor tells you कि आप ऐसे ध्यान रखें foot का, तो आपको ध्यान रखना चाहिए. और रेगुलर चेकअप करेंगे अगर 80% amputation prevent हो जाएगा. अगर आप बीपी कंट्रोल सही रखेंगे, ब्लड ग्लूकोज सही कंट्रोल करेंगे और किडनी कॉम्प्लिकेशन डिटेक्ट करने के लिए यूरिन टेस्ट होता है, check it and not mentioned here. So you can manual regular course. So do that from time to time to screen for kidney complications. Then you can detect its complications early and prevent progression. We have now drugs which can prevent progression, provided you detect early. So kidney failure भी prevent हो सकती है. यहाँ 50% लिखा है लेकिन with your drugs it's even 70% 80% prevent. So prevention of complications is eminently possible. Whatever is of time. Same thing holds for our disease. The last part, in the next 5 minutes, we talk about how to prevent diabetes itself. उस सेक्टर में क्यों पड़े complications? मैंने diabetes को prevent करने का नहीं. People are also taught, even as a diabetic individual, if you can aggressively follow a good lifestyle early in the course of diabetes, you might what we call reverse or remission diabetes can happen. Basic मोटी-मोटी बात ये है कि risk factors को risk factors से जोड़ करना. हमें risk factor दिखना है, हमें उससे बचना है और अगर ऑलरेडी आगे हो तो risk factor को कम करना है. मोटे हैं तो पतले हो जाए, ज़्यादा अनहेल्दी फूड खा रहे हैं तो हेल्दी भी शिफ्ट हो जाए, अगर सेडेंटरी हैं तो एक्टिव हो जाए, stress है तो stress कम कर लें. The risk factors go back up one way or the other. That's a fundamental change in lifestyle. Same thing, diet, regular exercise, if you are diabetic, medication adherence, and so on. So the first part is activity. कोई भी activity चुन लीजिए. अगर आप if most of you, as most Indians are inactive, आप में से कोई खेलता है स्पोर्ट्स गेम्स, कुछ खेलते हैं स्टूडेंट्स? आपको सबसे ज्यादा जरूरी है स्टॉप का, क्योंकि आप अभी तो कुछ नहीं है आपको, लेकिन यू आर नाउ. आई वांटेड टू मेंशन दिस अर्लियर आल्सो. Diabetes in our country is now being seen earlier and earlier and earlier. पहले 40-50 के बाद डायबिटीज देखा जाता है. हमारे कंट्री में पहले 10 साल पहले बिकॉज वी आर predisposed, तो 30s में शुरू हो गया. Now we are seeing diabetes, type 2 diabetes, that is in 20s and even in the second decade or sometimes even under 10 years, because मोटापा बढ़ गया. So it's as relevant for you as for those sitting in the front. Probably more relevant. Prevention is more relevant in your case. Please indulge in one or the other form of physical activity right now, start from now and for the rest of your life. ठीक है? आपके लिए ज़्यादा काम करेगा, isn't it? Because your body is there to be exposed to all those things. So healthy exercise, please at least 150 minutes of exercise a week. Detail will not talk. Second is that good diet and nutrition. What is healthy nutrition? Is shown in this bucket set. बता रहा है कि ये समझने से तो plate concept. Plate concept all of you should understand. आजकल शायद plate में ऐसे नहीं खाते हैं. 4 चपाती, 5 चपाती और fatty meals और क्या कहते हैं gravy, lot of fat in that. ये main होता है हमारा. एक तो vegetables का कुछ helping होती है. Maybe fruit, may not be fruit. But what you should take is half of the plate, look at the left half. It only has vegetables and fruits. Half the plate should be vegetables and fruits. 1/4 should be proteins, जो बराबर. Dairy food, if you eat egg or nuts, इसमें protein source ज़्यादा है. Only 1/4 should be cereals. चपाती और rice और कुछ. Only 1/4. और उसमें भी मैं आपको आधा किलो फ्रूट्स और वेजिटेबल्स, नॉट एंटायरली फ्रूट, वेजिटेबल्स और फ्रूट मिला के आधा किलो पर डे होल ग्रेन ज्यादा. कार्बोहाइड्रेट समझे से कार्बोहाइड्रेट ज्यादा करने से ना कुछ करेक्ट, बट इफ यू ईट हेल्दी कार्बोहाइड्रेट, इफ यू गो कॉम्प्लेक्स कार्बोहाइड्रेट इज नॉट अ फाइबर. ब्राउन ब्रेड की बात करते हैं, होल ग्रेन सीरियल की बात करते हैं, होल व्हीट ब्रेड में मिल जाता है. These are better options. And finally, stress. Yoga is one way which is shown. Other you can follow your own method of stress mitigation. But yoga is something which is shown to increase the ability to cope with stress. आप अगर हमें exam stress और academic stress होते हैं. Yoga is an easy method which has been shown to. Some of these points are given here. We did a study, actually, the only study in the world in the form of a 3-year-long controlled trial, where we actually showed that if you do 40 minutes of a particular structured yoga, I'll show you the picture of what we did. You can prevent diabetes to the extent of 40%. चाहे आपको वेट ना भी कंट्रोल हो तो भी डायबिटीज हो जाता है. इसका मतलब स्ट्रेस पे कम करना. So yoga is a very good method which can be easily followed to prevent diabetes. These are the asanas. I know get into the asanas, but there are several asanas which are useful for treating diabetes as well as preventing diabetes. I think yoga is one of the important methods. We do it in our center. Therefore, healthy living is the concept. This is what we mean by healthy living. So सब कुछ है. If you are able to imbibe this in our day-to-day life, diabetes तो नहीं होगी. उसके अलावा और भी बहुत सारे benefits हैं. आगे से नहीं होगी. Computer friends, being more productive, so many other things. So healthy living is key to all of us. And
particularly from the students or from the faculty. I tried at my school.
One question is on implementation as answered, can be improved on this? That's another question. अभी कुछ चीजों ऐसा ओके आपका फ्रेंड ने बताया था मैं also elaborate on that. आप पूछ रहे
I've seen some reports about the HB1AC test for blood sugar. What is that exactly?
I got these set of questions. First, HbA1c. मुझे वैसे सवाल आया. HbA1c is a blood test which gives an idea about the level of blood glucose control over the last 3 months. एक सिंगल टेस्ट है जिससे मैं आइडिया लग जाएगा कि इसमें 1 महीने में आपका शुगर इस कंट्रोल कैसे होगा. That is what is HbA1c. Okay. Now, normally or generally it is used to assess whether your diabetes, once you have been diagnosed, whether that is in control or not. The normal function of HbA1c is a doctor will order this once every 3 months or 6 months to see whether the control is adequate or not after the diagnosis of diabetes. That is the primary role. आपका क्वेश्चन आंसर हो गया. अब इनका क्वेश्चन ये है कि डायग्नोसिस के लिए यूज कर सकते हैं क्योंकि लोग कर रहे हैं. उसमें दो बातें हैं. Using HbA1c alone for making a diagnosis of diabetes has a lot of limitations, particularly in our country. In the West, they are using HbA1c alone for diagnosing diabetes. They say anything above 6.5 is diabetes. Okay. Anything above 6.5 is diabetes. तो और कुछ करने की जरूरत नहीं है. अगर HbA1c आपका 6.5 होता है तो diabetes. We can't use it if we don't recommend in India. HbA1c alone should be used. Can be used for corroborating a diabetes. Fasting और HbA1c साथ में कर सकते हैं. फास्ट BP और HbA1c भी कर सकते हैं. लेकिन अकेले HbA1c करने में बहुत प्रॉब्लम होता है. Some of which are relating to the way it is tested. Number one, they are not proper. They don't have accurate method. Even if we have accurate method, there are certain things in our community which don't allow the same cutoff to be used. Therefore, it is better to use HbA1c along with fasting and post-glucose tests for that. HbA1c autoimmunity, somebody said आपका गलत है. आपने क्या पूछा? Pancreas. Autoimmunity में आता है pancreas. Autoimmunity is got a role only for type 1 diabetes. Type 1 diabetes. जैसे मैंने बताया. Autoimmunity का type 2 diabetes में कोई रोल नहीं. Genetic रोल है बाकी लाइफस्टाइल. Autoimmunity कोई रोल. Autoimmunity रोल जरूर है कि type 1 diabetes आपने ये देखा होगा. कोविड के बाद diabetes, new diabetes भी बढ़ने लगा. All that was type 1. That was because of immune phenomena related to COVID, which remained the practicality. तो बाद में ये स्टेरॉइड थेरेपी देखने के साथ कि डायबिटीज बढ़ेगा. वो टाइप 1 डायबिटीज. So type 1 diabetes is like autoimmunity primarily. Is there any method by which you can improve the function of pancreas? Pancreas insulin ज़्यादा निकले इसके लिए भी ज़्यादा देगा नहीं. यही है. Yes, there are two aspects. One is can you make the pancreas secrete more insulin? ये तो डायरेक्ट है. उसके लिए दवाई है. जो डायबिटिक पेशेंट्स हैं या फैमिली में किसी के डायबिटिक पेशेंट हो, उन्होंने ग्लाइकोसाइड का नाम सुना होगा. ग्लाइकोसाइड नाम की दवा है आपकी. इसके नाम यही pancreas से insulin ज़्यादा secrete कर रहा है. Its primary role is that. That group of drugs work by making the pancreas release more insulin. But that is not the same as your first question. Basically, it's not the same as saying that pancreas का function improve कर. मतलब ये नहीं. बल्कि उल्टा. अगर आप ज़्यादा इम्प्लीमेंट देते जाओगे सालों में तो जो काम कर रहा है वो भी खत्म हो जाएगा. After some time, the drug will stop working. So there are some agents which are there, which are improving what we call beta cell function. Beta cell का मतलब है वो सेल में फंक्शन निकलता है. उस फंक्शन को भी इम्प्रूव करता है. So there are methods. Let's not go into detail, but there are methods. There are newer drugs as well as other things. In fact, if you take insulin for some time, तभी and then stop later, beta cell function और बढ़ जाता है. So there are methods to improve magnetic function. और कोई सवाल था? These are listed. What is your opinion in insulin function? But first set of questions में कोई मिस तो नहीं हुआ चला.
Can diabetes be not genetic? If it is not genetic, why can't you remove it?
Two questions. First question, I already forgot. First question is, can diabetes, there is type 2 diabetes is talking about. Type 1 ज़्यादातर non-genetic है. Type 2 diabetes can it be non-genetic? और अगर non-genetic है तो reverse क्यों नहीं कर सकते? मैंने शुरू में ही कहा था कि चाहे genetic हो या non-genetic हो, आप prevent भी कर सकते हैं और reverse भी कर सकते हैं. पहले वो समझ लो. जेनेटिक का मतलब सिर्फ इतना है कि there is an extra risk. We are more predisposed. We are more likely to become that. Yes. जेनेटिक का इतना रोल. It is not like traditional gene disorder जिसमें अगर एक चीज खराब है तो बीमारी हो गई. ऐसा नहीं है. जीन जेनेटिक्स ऑपरेट डिफरेंटली. जेनेटिक्स से आपको सिर्फ रिस्क फैक्टर बढ़ता है. चांसेस ऑफ बिकम डायबिटिक बढ़ता है. Actually, diabetes obviously depends on your lifestyle. So even if you are genetically predisposed, even then, and especially if you have no genetic factors, then definitely you can prevent diabetes by changing your lifestyle. You can even reverse diabetes.
You get off of metformin.
Yes, okay, that is what is called reversal, although I don't have it. You can get into remission. That remission means off drugs. You can get into remission if you follow a strict, whatever I told you, if you follow it strictly and aggressively. And in a sustained manner. बहुत आसान है कहना. आपको follow करना पड़ेगा. Follow कर सकते हैं, लोग करते हैं. If you can do that, you can be off drugs. Especially if you are obese, especially if your diabetes is short duration, 2-4 diabetes है आपको insulin already नहीं है, आपको कोई complications नहीं है. In those situations, you can reverse. Or you can get into remission. Remission के बाद भी आपको काम करते रहना पड़ेगा. It's not like a money. या इन्फेक्शन, आपका इन्फेक्शन ठीक हो गया उसके बाद बस खत्म. मैं बोल दूँ ये नहीं हो सकता. आपने जो मेहनत किया, आप ड्रग से बच के निकल गए, मेहनत छोड़ नहीं सकते. You have to continue your lifestyle for the rest of your life. ये नहीं कह सकते तो क्या कमाएंगे नहीं करेंगे तो. As long as you maintain your lifestyle, you can be off drugs. It's possible.
So like at what stage a person will start taking insulin? Like sometimes the blood sugar level is high, still doctors suggest give some medicine. But like at what blood sugar level, person will start taking insulin.
Okay. Any other question from here?
Basic idea of this does this type of material help in control of diabetes?
First independent fasting. Independent fasting basically बात कर रहे हैं weight reduction. अगर obesity factor है आपके diabetes में और obesity भी साथ में है, तो क्या होगा independent fasting बात करने पहले से आपको आपका weight नॉर्मल है वैसे हो. Now intermittent fasting क्या होता है? It only means that your eating window is less. In a 24-hour period. ना 24 घंटे ऐसे नहीं खाते रात को सो जाते हैं. लेकिन अगर इसको एक्सटेंड कर सकते हैं और अगर हम ये कहें कि 16 घंटे आप कुछ ना खाओ, जो भी खाना है 8 घंटे में खाओ, टोटल 8 आवर्स इन डे. सुबह अगर 8 बजे से चल गया तो 4 बजे तक चलना पड़ेगा. सुबह अगर 10 बजे चालू किया तो 6 बजे तक चलना पड़ेगा. उसके बाद नेक्स्ट डे मॉर्निंग 8 बजे तक नहीं खाएंगे. So if you can extend this for 16 hours, then that has been shown in several studies to help pregnancy. कुछ स्टडीज ऐसे भी जो कहते हैं कि नहीं, इससे हो जाता है कि आप जब 8 घंटे करते हो वैसे ही घूमना चाहिए, ओरल कैलोरीज भी ऑटोमेटिकली कम हो जाती है, तो एक्चुअली उसकी वजह से हो, दिस इज जस्ट अ मेथड. तो इधर वे जो कि तो इंप्लीमेंट कर सकते हैं, स्पेशली इफ यू टेक इट अर्ली डिलीवरी. जब 16 घंटे नहीं कि 14 घंटे भी करें. In diabetes, the fundamental rule is the earlier the later the better. तो अगर आप 10 बजे लेटर करेंगे तो प्रॉब्लम ज़्यादा है, अगर आप 6-7 बजे लेटर करते हैं तो बेटर. That is one part, and it is useful for reducing delay. Second question was
not helpful for diabetes.
no, not for diabetes treatment per se. उसके लिए treatment fasting, intermittent fasting बोलते ही इस diabetes. उसके main problems. But intermittent fasting का अगर जो बेस है, तो weight reduction है, वो indirectly help करेगा, वो करेगा. यहाँ से तो Ayurvedic preparation, some of the Ayurvedic preparations do have effect on reducing drug abuse. That's statement number 1. Statement number 2. मेथी, इसके बारे में मेथी पाउडर, मेथी सीड्स, मेथी पल्सेस does have some role in English we call it fenugreek, does have a role in reducing blood. These Karela juice can reduce blood pressure. ठीक है, और भी कोई प्रिपरेशन जिससे ब्लड ग्लूकोज कम हो सकता है. Now, but this question is not that. This question is not कि क्या वो ब्लड ग्लूकोज कम कर सकते हैं या नहीं, क्या वो ट्रीटमेंट कर सकते हैं या नहीं कर सकते. That was his question. We do not advise any Ayurvedic medicine to be used for treating diabetes. Why? Firstly, you should not take these medicines with the idea that it's going to cure your diabetes. ये पहला misconception होता है. मैंने आयुर्वेदिक ले लिया, मेरा डायबिटीज तो क्योर हो गया, एक महीने मैंने फेरल जूस ले लिया तो डायबिटीज चलेगी. That is wrong. Don't take it with that in mind. Number 2, Ayurvedic drugs are safer. ये एक second misconception. Ayurvedic drugs in general don't have side effects, but several of the preparations which are used by Ayurvedic physicians to treat diabetes have lot of toxicity, especially to the kidney. I have known several patients who have stopped their allopathic drugs, switched to Ayurvedic medication, the false belief that everything is fine. उसके बाद उनको इतना बताया जाता है कि आपकी डायबिटीज दूर हो गई, बंद हो गई, तो टेस्ट करना भी छोड़ देते हैं, है ना. उससे क्या होता है, after 3 years or so, they end up with kidney failure, back to an allopathic physician. So we do not advise. तीसरी, if you still insist that मुझे मैं केरला जूस तो मैं जब भी खाता हूँ मेरा तो कम हो जाता है शुगर, मैं क्यों नहीं ले सकता? You can, if you are consistent, you can, but then it's just another drug. We clear that it is working like another drug like glimepiride. वो उसका glimepiride का ज़्यादा अंतर नहीं है. How it works is similar. तो glimepiride आप एक गोली लेके 1.5 दिन करना चाहते हैं, लेकिन केरला जूस खाना चाहते हैं, पीना चाहते हैं, ठीक है? लेकिन प्रॉब्लम क्या है? केरला जूस cannot give predictable reduction blood glucose. आप ये कभी इंश्योर नहीं कर सकते कि केरला जूस चाहे उतना ही क्वांटिटी में उसी टाइम आप ले रहे हैं, तब भी जरूरी नहीं कि इफेक्ट्स डे टू डे के सेम हो. जो ये देखा गया कि डिपेंडिंग ऑन द क्रॉप, डिपेंडिंग ऑन हाउ द जूस इज मेड, डिपेंडिंग ऑन द अमाउंट, द इफेक्ट कितना होगा दैट वेरी, व्हिच वी डोंट वांट इन दैट. यू वांट अ फिक्स्ड इफेक्ट. जो हमें दवाई से पता है कि इतना डोज देंगे तो इतना इफेक्ट होगा. केरला जूस ऐसे नहीं है. Even the crop, if it is different, the effect will be same for many. The crops are different, the effect will be different. Nobody can predict. तो जब आपका predictable चीज है, गोली है, जब उसको पता है कि 5 मिलीग्राम आने के जो इतने इफेक्ट होगा, 10 मिलीग्राम इतने इफेक्ट होगा, और रोज ये भी रोज लेना है, वो भी रोज लेना है, ये भी टाइम से लेना है, वो भी टाइम से पीना, ये भी जिंदगी भर लेना है, वो भी जिंदगी भर लेना है. Yours, yours. क्यों नहीं होगा? Second question कुछ होगा? इंसुलिन क्या था? Yes. इंसुलिन का सवाल यह है कि कई बार डॉक्टर कह देते हैं कि आपका डायबिटीज तो है, और बेसिक कारण हमने बोला कि इंसुलिन नहीं है, ये काम नहीं कर रहा, तो गोली क्यों दे रहे हैं? गोली कहते हैं कि इंसुलिन क्यों दे रहे हैं शुरू से? ये कहते हैं सर आइडियली वो बेस्ट है हर पेशेंट को अगर इंसुलिन डे 1 से दे दें बेस्ट है लेकिन कौन लेना चाहे अगर आपको मैं बताऊं आपको डायबिटीज हो गया से आपको सुई लगेगी जिंदगी भर you will never take isn't it so but there are drugs which do this similar thing for example glutathione is making the body produce the next insulin so वो भी बढ़ा रहा है इंसुलिन पास ही नहीं
But the blood sugar is like very high. Still, doctor no suggest medicine.
वो now the question is slightly different उनका सवाल ये है कि इंसुलिन को लेने में गोली देने में रोल नहीं तब भी डॉक्टर इंसुलिन नहीं बता रहा क्या गोली लेते जाओ ये गलत that is wrong if somebody is doing that it is wrong the basic dictum and all of us follow that we are supposed to follow that and you also should know you should get your glucose levels in target as soon as possible fasting 115 10 80 140 60 या 80 मैक्सिमम इसमें नहीं आया तो आपको नेक्स्ट स्टेप पे जाना ही जाना एक गोली से नहीं होना दो से नहीं होना तीन से नहीं होना तो या तो दवा के साथ या फिर मैं sooner or later every time we have to reach a stage where insulin is required so don't delay beyond what you should so don't allow blood glucose to remain 250-300 for years वो क्या नुकसान कर रहा है ना तो क्या फायदा बना इंसुलिन दे देना टाइम भी दे देना
And now it's time to honor our community here. I would request our honorable President, Mr. Agarwal, to honor Mr. Madhu with a flag. I also request Professor Agarwal to honor Dr. Ashwini Kumar. I request our senior VP, Professor Chaturvedi, to honor our honorable President. you.